if you have this issues, it can cause a lot of disorder. In passing, it can cause something like anxiety disorder symptoms, general anxiety disorder, or they call it GAD. So I already shared to you some of these general anxiety symptoms, whether physical, psychological, or behavioral. And some is what they call panic attack symptoms. If you feel like this, chest pain, sweating, shortness of breath, social anxiety disorder symptoms, like you are blushing, sweating when you are with people, muscle tension, slacking, nausea, and then you want to escape, avoid. And also some post-traumatic stress disorder, like this is developed in a person is experiencing traumatic events or dramatic events, like if ever being raped, combat exposure, like they saw fighting, no? So let us not, as parents, let's not show our children that we fight in front of them or combat talaga, no? Or let us not expose them to so much extreme. That's why sa mga movie, there are also um, this is not good for 13 years old and below, like that. So let's also observe that. And childhood neglect, childhood physical abuse. Wait ha, I need to naglobat. So mga sexual molestation, rape, physical attack, and being threatened with a weapon. So these are traumatic experience that may lead to PTSD disorder. So mga assault, those domestic abuse, that's why you guard yourself. If you are in a relationship that is affecting your mental health, give yourself space also, no? And prison stay, terrorism, war. So in the last days there will be rumors of war, so let's guard our mental health, our heart. So let's be strong in the Lord. So activities or situation like we have a accident, crash, mga natural disaster, which I have shared earlier, mga assault. So these are symptoms also that you can see: loss of interest in the things you like, tough times expressing positive emotion, parang puro na lang negative that comes out from your mouth, super hyper vigilant, parang vigilance like you are already parang paranoid that there's something wrong might happen. So mga nightmare and flashback of the traumatic events, avoidance to place the things that reminds you. So feeling hopeless, helpless, guilty, and shameful. So if you're experiencing this, trust God and to help us, because sometimes you are not already like feeling of in control of your emotions. So if prolonged anxiety and exposure to stress, some children and adults suffer obsession, compulsion, where you are fear of contamination, parang you are so thoughts of doubt, you have these things, fear of accidentally harming self and others, and need for symmetry, exactness, parang you are perfectionist, repugnant, obsession, compulsion, checking, compulsion, ordering, arranging compulsion, mental rituals, need to ask and confess, hoarding. So you assess yourself if you have this behavior. And 7 to 12 years old in children may have this. That's why there are children that are doing repetitive behavior. So that's why there are a lot of associated or comorbidity issues relating to OCD. Those are like we are diagnosing them as special kids or special needs, not only in children but adults. So they could be anxiety, Tourette's, like cannot control their twitching, and gifted sensory integration disorder, mga autism spectrum disorder, depression, ADHD. So may God help us to help our kids with special needs. So that's why I'm proponent also to help parents with special kids, because I also have my own special child. So I want to invite you to join me in my sharing of practical neurosensory reflex integration, which is every Saturday, 2 to 3 p.m. Philippine time. So PM if you're interested, because this is very helpful that parents or us, even you're not a parent or you are not an educator, but you are experiencing some symptoms of anxiety due to some traumatic experience, this is a good therapy for all of us. Even to me, I also apply it to myself, no? So that because we are living in a stressful time, so we have to know how to guard ourselves through self-care and other therapy that we know. And talk to your loved ones, no? Therapeutic din yan, talking therapy. So